Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Grant Elliott is a chiropractor and the creator of the #1 online low back pain program, helping thousands of people worldwide eliminate pain without unnecessary treatments, surgeries, or endless chiropractic visits. His mission is deeply personal. After a career ending injury as a competitive athlete, Grant discovered just how broken and outdated traditional back pain care really is. Instead of accepting the status quo, he built a science based, disruptive approach that puts healing back in the hands of the individual. Today, Grant is a leading voice challenging myths about back pain, proving that your spine is stronger than you think, posture isn't everything, and most diagnoses actually keep people stuck in pain unnecessarily. His no nonsense, empowering approach is revolutionizing how people recover while calling out the sick care system that profits from keeping people dependent. Grant's mission is clear: to end the back pain epidemic by educating, empowering, and equipping people with the tools to help themselves. His journey from injured athlete to health disruptor makes him an inspiring and high impact expert for his followers. Grant Elliott, what an absolute honor it is to welcome you to Boundless Body Radio.
Thank you so much. Appreciate being here.
Absolutely. It's so cool to host you and really get into your content. Yesterday, I was involved in helping to kind of do an introductory video for personal trainers who are just starting their careers and how to think about like program design and that sort of thing. And after consuming some of your content, I realized, like, even as recent as yesterday, I may need to revise some of the things that I was explaining and my thinking around certain things. There's a lot of myths in this kind of area, and the way you've explained things has me second guessing a few things for sure. So I'm excited for this conversation today.
Good. My mission's winning. And listen, that's how we all should feel. And that's how I want to feel throughout the years too, because it means I'm adapting, it means I'm learning more, and it means we're changing with the evidence.
Gotcha. Well, perfect. And it's good timing for the recording of this episode for two reasons. Number one is this Sunday, I am going to watch a Utah Mammoth game where we're playing your Tampa Bay Bolts, the Lightning. Even though you're not a sports fan, you told me off air, it's at least in the town that you're at right now. So you will be rooting for them, which should be quite helpful for us. So we appreciate
Yeah.
that.
Yeah. Yeah.
The second reason that this has been such great timing of the recording of this episode, an episode that you have recorded previously, dropped today with two of my really, really good friends, Jack Heald and Dr. Phil Ovadia, on the Stay Off My Operating Table podcast. And I've always noticed it's such an interesting kind of interplay between people who do what you do and people like us in more of like the metabolic space who have been, somewhat involved in the medical system and kind of smell a rat. Like Phil is a great example of that. Somebody who's doing a lot of heart surgeries to help people, was told all the things that he was told about what causes heart disease, to then second guess that kind of thing. We really share that kind of like passion of like not necessarily following the norm and trying to get outside of that to find better solutions for people.
Yep. 100%. And on that note, there was another podcast I did just the other day, and it was with a spine surgeon. So it's one who's directly in my space. And he started implementing a protocol where before he would perform spine surgery on anyone, he made it mandatory that they would evaluate their lifestyles, they would focus on sleep, and they would just simply move more. Like nothing crazy. And the rate of his spine surgeries went down almost 90%. And
Wow.
so he completely removed himself from spine surgery completely. He's a non-practicing surgeon who then fully dedicated his career to creating education and a practice around lifestyle choices, movement-based therapy, conservative care, with the sole goal of canceling surgeries.
That's incredible. Wow. But think about the financial hit you would take to be able to take that decision.
Yep. Yeah,
Wow.
I mean, you got to care about doing the right thing. You got to care about the evidence, and not to say that advice, like if you're helping someone cancel a $10,000 surgery, then that advice is worth $10,000 too. And you can still certainly charge what the education, what that value is provided, but with the sole goal of disrupting the system, as you stated earlier. Yeah, like you got to be a pioneer, and you got to care about really what matters.
Yeah, that's incredible. Good for him. We wish him all of the success for providing value for people that are avoiding the surgeries. Because, man, I remember taking a course on back pain several years ago, where an expert in back pain kind of came in and talked to us about a few certain things to a personal training group, and it was just like you know 90% of you, 85% of you, whatever the number is, of Americans, I should say, will have back pain at some point. I remember hearing that like maybe 50% of that back pain will just like clear up on its own without you ever having any idea what caused it or what made it even feel better. And it just seems like this crazy thing that happens to people, and they don't really have a lot of resources. And unfortunately, they do eventually get to the surgeon and do surgeries that seem to not really help all that much. You know what I mean?
Yeah. So I assume a lot of your listeners are personal trainers, fitness enthusiasts. So I like to use examples that hit home for you, the host, and the audience the most. So let me ask you this, Casey. If I was one of your clients, and let's just say I was like, oh, like my hamstring's like a little extra sore. I think I might have like pulled my hamstring, strained my hamstring a little bit. You probably wouldn't freak out. You would, and correct me if I'm wrong. You'd probably be like, oh yeah, like must have increased the load a little bit too much. Like you strained the muscle, like let's deload for a couple weeks and we'll be good.
Yeah,
Like,
dance around it a little bit, right?
right. Yeah. No big deal. So now think about it this way. Same scenario occurs. I'm training with you. Up, think I, strained my hamstring a little bit. And I immediately run to get imaging. I run to get an x-ray. I run to get an MRI. I go to the specialist. And for those listening, I'm doing bunny ears. I'm doing quotation marks on that. And now instead of just, oh yeah, it's a strain, I get a scary MRI report. And it says, all the scariest language I could have imagined. Hamstring contusion, internal bruising, edema, signs of muscular tear, all this. And so I'm going from you just saying, oh, yeah, probably strained your hamstring, no big deal, to all these scary words that are seeking into my brain and completely changing my nervous system's reaction to this. Then the authority comes in and goes, yep, there's a strain. You tore part of your hamstring. We need to consider, injections for XYZ. And if we don't see this change in a certain amount of time, or we need to surgically repair your hamstring and do this to it. And I'm going, oh my gosh. And I'm freaking out. And in both scenarios, it's the same injury. But in either scenario, my initial approach, my experience with it, the information that I'm provided completely changes the way that scenario is managed. And it can push me towards a very scary place, towards a very costly place, towards a chronic, a life altering place, or it could push me to a common strain, dance around it for a couple weeks, and I'm probably going to be okay.
Yeah,
And that's
that's
the world
super
of
well
back pain.
explained. That's super well explained. I really like that. It's all in the way that kind of information is presented. Like I remember hearing somebody talk about like how a doctor might say, "Hey, we're going to do this procedure. There's a 10% chance that you might not make it through this procedure." Like, holy smokes, 10%, that's crazy. Where if you rephrased it and said like you have a 90% survival rate of this procedure, those two things land a lot differently. But you're right. Like to have that kind of like diagnosis, the stress alone from something like that is probably more harmful than the original injury is anyway.
Yeah, absolutely. Because it's all about the narrative that's being provided. So that same scenario, obviously the listeners can understand I'm drawing a parallel to back pain. People commonly strain themselves in the gym. It's not a big deal. That's part of being fit and being active. And trust me, if you're a couch potato, you're going to suffer a lot more injuries than you are if you're keeping yourself healthy. But in the back pain world, it's not uncommon for someone to have a common strain in their low back. And to your point earlier, there's a very high percentage that will self-resolve within 2 to 3 weeks. Self-resolve. But in that scenario, let's say I have a common low back strain. It will self-resolve in 3 weeks, but I get a scary narrative instead of a positive narrative. Instead of you telling me, hey, you know what? You're probably going to be fine. You don't have any scary signs or symptoms. You're going to be good. Like, okay, positive thinking. I'm the other example. I'm rushed to a general practitioner that's not trained in low back issues. He goes, well, I don't know what to do. Here's your meds. Here's a script for an MRI. I get the MRI. It shows a disc bulge. And then I'm getting pushed to a surgical console. And now everything's different when in reality, I would have been completely fine in 3 weeks, but now I'm on an operating table.
Crazy.
Happens every single day.
That's
Every
crazy.
day.
Wow. It's like you said, that the course of your life, thinking about like how that's going to go for the rest of your life is going to be completely different from that moment. So, wow, yeah. Thank you for explaining all that. Let's go back to your own personal story. We alluded to in the introduction where we mentioned that you were a competitive athlete. Things were looking really good. How did you yourself, having gone through, low back issues, why did that become a driving force for you to get into this field?
Yeah. So I became a chiropractor because a chiropractor failed me. That's ultimately it. So I was a competitive cyclist. I was getting scholarship opportunities. I'll make a long story short. My back pain increased, started really impacting my races. My placings got worse and worse and worse. So I went to chiropractor. A old school traditional chiropractor is what I would verbalize them as, which is take x-rays, your spine's crooked. We got to get your spine straight and you got to see me 3 times a week forever, and no results. And so my racing got worse, lost those opportunities, and then just got into working out and just training in general. And then a couple years later, met a chiropractor who was rehab focused, movement focused, teaching people how to fix themselves. And I was like, oh my gosh, if this was what I would have received, like things would have been different. And so I wanted to become a good chiropractor to reduce the chances of other people out there being in my situation, seeing someone who is inadequate, not providing an evidence based approach. And that's what motivated me to then do this. So from day one in school, I was super rehab focused, soft tissue work as well, like all the things I could do to get someone the fastest result possible would not need me. That was my number one goal, for people to not need me as quickly as possible. And then about halfway through school, my plan was to go back to Indiana and work at a clinic. And I realized, you know what? Social media is important now. I should probably build a base of some capacity. So I just started posting once a week, just the stuff I was learning in school. I started slowly getting more followers, and that was cool to me. I was like, oh my gosh, I posted something and now it's growing. Oh, I posted something, got more views. And I fell in love with that process, just growing my social media channel. There was no goal at all. I was just going to use it as a portfolio. But I fell in love with that process. So then a year before graduating, I made the goal of posting 1 time per day for the entire year. And I did that, grew 100,000 followers before I graduated, and that launched my business and eventually launched me online and turned into everything that there is now.
It's amazing. Wow, there's such a stigma about, social media and influencing, but that's where people are. Like if you want to go find people, that's what you have to do. So kudos to you for thinking that through and building a following there. I think that's amazing. And can you tell us what it is that is deficient that you noticed in the chiropractic care that does keep people coming over and over and over to the same chiropractor for, months, years, whatever it is? You hear that story all the time.
Yeah, you hear it all the time, but the one thing I want to bring to the attention is that that exists in every single industry, though. So, like at the highest level of healthcare, we all look the same. If you're an evidence-based chiropractor, you're going to have a similar amount of knowledge and you're going to operate the same as an evidence-based physical therapist, as an evidence-based orthopedist, as an evidence-based neurosurgeon. Like we have the same conversations. We understand clinical guidelines. The problem is for non-evidence-based, non-progressive individuals, then you see this trend, and I'll give examples that exist in each. So the bad stereotype, but the true example for chiropractors is like, yeah, spine's crooked, x-rays, 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 see me every week forever. But the same thing exists in physical therapy, which is the inadequate care of, hey, you're going to sit on the treadmill for 10 minutes. We're going to do an ice pack on your back and we're going to do ultrasound, come back every week until insurance runs out. Okay. The example for medical providers is, hey, I don't know how to manage this musculoskeletal condition. So here's your drug script. Here's your gabapentin. Here's your whatever. Just keep coming back and we'll keep refilling it. It's the same scenario, just in different industries. And so the biggest missing piece there is one, evidence-based care. So teaching people independence. What can they do to fix themselves? That's the missing piece. A reliance on what's called passive therapy. Passive therapy are things being done for you or given to you, aka drugs or adjustments or soft tissue work, massage, needling, laser. These are all things being done to you or for you, but they're not things that you're learning how to do for yourself. So if you don't have an approach that's teaching you what to do, what you can do on your own to take your care into your own hands, then it's going to be an inadequate approach that likely will not last long term. So when you look at your care, when you're seeing a medical doctor, physical therapist, chiro, whatever, it doesn't matter, you would want to see about 80% of your care is active therapy. You're doing the thing, you're doing the movement, you're doing the rehab, you're doing the lifestyle intervention. That should be 80% of what's getting you to your outcome. About 20% should be passive therapies. Now, I'm not saying you should have 20%. You don't need any passive therapies the majority of the time. You need zero. But if there is going to be involvement, the point I'm emphasizing is it only be about 20%. If it's more than that, if it's 50% of your care, there's an over reliance on passive therapies and you might be receiving inadequate care.
Excellent. Okay. I definitely want to talk about that. Before we do, maybe it would be a good idea to kind of go through the anatomy of the spine. I think a lot of listeners out there may have gotten a little surprised in the introduction when we said that you're trying to go out there and tell people the spine is actually a lot stronger than you think it is. I think most of us have this idea of like this fragile column and things stacked on top of each other and things pop out and bounce around all the time. Like, can we talk a little bit about the construction of the spine, and we'll use that to kind of talk about some of the common issues that people have.
Yeah, and there's so many myths. I do truly enjoy talking about all the myths, especially in the fitness world, because we hear this a lot. And this is a community that can really benefit from learning the myths and understanding the reality of the situation, because these are perpetuated a lot. So we'll dive into those for sure. General anatomy, yeah, spinal column consists of bones with discs between them. You'll hear the phrase slipped disc. That's a harmful narrative. These structures do not easily move. We've heard the term out of alignment. Okay, that is a myth. Your spine does not easily become out of alignment. You need to be hit by a truck probably for your spine to go out of alignment. Like your spine and your pelvis and the way they integrate. Trust me, I was dissecting cadavers, and there's so much dense tissue around a spine. There's so much connective tissue. Everything is intertwined. It is ridiculous how strong a spine is. It is incredibly strong. And on top of that, it can adapt. There's this old information that a disc can't heal and that spinal structures can't heal. Well, let me relate it back to fitness. If I hit a good leg day and my legs get sore, do they stay sore for the rest of my life and just keep getting more and more and more and more sore? Or does the muscle tissue grow and adapt? Oh my gosh, it grows and adapts. So why would your spine not be able to do that? It's a part of your musculoskeletal system. It reacts the same. Osteoporosis. How do we confront osteoporosis? We load the bone, and of course, we provide adequate, calcium, vitamin D, K, things to improve nutrient absorption and build bone. So load increases bone mineral density. Load increases muscular density. Bone also increases disc density. Discs can adapt, they can heal, they can get stronger. And I know you want me to talk about anatomy. I'm going much differently than that. There's two primary components of the disc. The inner gel-like substance is the nucleus pulposus. That's the substance that can leak out in a disc bulge or herniation. And the outer portion is a tough, fibrous collagen layer called the annulus fibrosus. And so when you load your spine, the vertebra that's between the discs, they get more dense and stronger. And then the discs themselves, these layers, primarily the collagen layer, it will get thicker and more dense. And that can adapt to load as well. And so what this also tells us, now I'm getting into the fitness community here. What this also tells us is that we don't want to stigmatize the position our body is in too much when we receive load, AKA form. So there's this notion that, oh my gosh, if someone's deadlifting with a rounded back, it's the worst thing for them. Or they're squatting with improper form, it's the worst thing for them. And in reality, that's not true, because your body can adapt to any and all positions. And in fact, it could actually be harmful for someone if they're only training in what's deemed as perfect form for their entire life. Because what they're not adapting to is any position outside of that. And we all know that when we're in life, doing life, you're not doing things in perfect form all the time, nor should you have to or consider that. So to keep this simple, someone who's going to develop a stronger spine, a stronger back and discs and everything, that is not someone who is only strong deadlifting with a perfect spine, perfectly straight, whatever. But if they're also strong deadlifting with a rounded spine or an overextended spine, if they're strong in all ranges of motion, then those discs and those structures are going to be adapted to all different forms of load, and they're going to be prepared for more of what life throws at them.
Got it. Okay. There already is one thing that I have been wrong about my entire career, being taught that like the notion that we would explain people is like, you have this perfect form when you're deadlifting. You need to watch out for that because then you'll bend over and tie your shoes, and that's when you're going to get hurt. So we can be training those types of movements to make that stronger in all of those situations rather than just this. The deadlift is like this, you do it this way. The spine position is the same. You're saying that's not necessarily the case.
100%. And now here's what some people might think. Oh, but wait, Grant. One time I strained my back and it's because my form failed. Exactly right. I'm not saying you can't hurt yourself in a form that you haven't been in. That's the exact point. Is if you find yourself loading a position that you're not adapted to, that's when you have a higher risk of injury. So it's not the movement or the form that's bad. It's the position that your body is not prepared for. So if I've been training, let's say Jefferson curls, okay, that's a classic one. Jefferson curls, okay, I'm doing basically a deadlift with a rounded back. If I've been training that and adapting to that over months and years, the chances of me injuring myself if I'm at the park picking my kid up in a low position who, let's say, is 50 pounds and I have a rounded back, the chances of me hurting myself in that position are slim to none. But if I've only been training my back in a neutral position for my whole life, and then I pick up my 50-pound kid with a rounded back, my chances of injury are very high. So it's not that you can't injure yourself in other ranges. I'm not saying form doesn't matter. That's not what I'm saying. What I'm saying is the form that you are not adapted to matters. And you want to adapt to as many different positions as you can over time, progressively. And that's what builds a robust body in all areas.
Yeah, got it. That nuance is so important. That's yeah, very well explained. I really like that, and I don't want to miss what you said earlier. My wife has actually done two of those cadaver classes herself, and learned so many interesting things about the body. I remember her telling us about the spine and how like really literally strong and difficult it was to kind of dissect. She also said, which really surprised me, like you think you have so much muscle fiber in your body, you have far less muscle tissue than you think you have. Maybe a little sad for all the bicep curls I do, but it was an interesting thought for sure. Is that something you noticed?
Yeah. There's so much connective tissue throughout the body. Yeah, it's really cool. But yeah, like if you're trying to like use your scalpel blades, you're like breaking your scalpel blade on discs.
Yeah.
Like that's like your spine's like steel in reality. So that's what kills me when, once again, like someone has a common strain, let's say in their back, and then they go to a general provider and they're being told, oh my gosh, look at this image. I can't believe you can walk. Like, you got to be careful. Your spine's out of alignment. You've disc degeneration. You need to lift with a perfect spine for the rest of your life or you're going to re-injure yourself. And I'm over here like, bro, like your spine is like a steel rod. Like, yes, they're having a pain experience right now. And there's many things that can affect a pain experience, not just tissue damage. There's so many other things that can affect it. But like to convince someone who at this point in time isn't under the impression that they're a weak or fragile person, and now you're convincing them that this area of their body that they move all the time is weak and fragile, like there's no positive outcome to the messaging that you're provided. And it's just completely false. Same thing with like, oh, your back pain is because your core is weak, or it's because your glutes are weak, or because your hips are uneven. Like all this stuff, it just segments the person. It's not evidence-based. None of that has a direct causational relationship that's proven in the evidence. None of those things do. And all it does is results in people over obsessing about their body, overly concerned on the wrong things, and not just focusing on movements and getting stronger.
Got it. Okay. Well, that's a good segue then. If the spine is so strong, you do hear the things all about the core as well. You just said there's many different ways that somebody could be experiencing pain. What are some of the more common ones? So the causes of back pain?
Well, when someone asks me the cause of back pain, I'm always going to refer to the literature. And what is the cause of back pain? Well, this is a tricky answer because a lot of people want me to say one thing, but that doesn't exist. 90% of low back pain is under the umbrella of non-specific low back pain. Non-specific meaning you can't trace it back to one specific source. So it's a combination of disc, muscle, and joint pain. Combination of those three things that are influenced by external factors, meaning mindset, the mental state of the individual, their societal influences, their interpersonal relationships, and what's going on in their life, their spouse stress, their work stress, all of these things impact our experience of pain. So a majority of low back pain is mechanical, meaning movement focus. It's a movement based problem. It needs a movement based solution. And vast majority of the time, you don't need surgery. In fact, 97% of lumbar disc herniations can resolve without surgery. But way more than that are being pushed to surgery, which is crazy. So you can't trace low back pain to a singular source, which is why when we tell someone the one reason your back is hurting is because your spine is crooked. Now they have a new belief system. Their belief is now, okay, you just showed me my spine is crooked on an x-ray. That has to be straight on an x-ray. Otherwise, I can't be out of pain. When in reality, very few people's spines are perfectly straight. It's normal to have a slightly twisted, slightly crooked, slightly uneven spine. It's totally normal. Like we all have asymmetries. So if you're tying someone's belief system to a singular source, that's damaging to them. So that singular source could be the uneven hips. It could be the weak glutes. It could be the weak core. It could be the uneven leg. It could be the misaligned spine. It is negligent for us to trace someone's pain experience to a singular source because it's not evidence-based at all, and it makes them obsess about the wrong thing. If instead we were to tell them, hey, based on your signs and symptoms, this is non-specific low back pain. It's a combination of disc, muscle, joint, or multiple things, and your chances of recovery are incredibly high. Let's also talk about other things that are going on in your life. And if you can see a correlation between maybe that particular week they injured themselves, maybe they had a really stressful week at work. So maybe their sleep was down 1 to 2 hours per night. So they're in a sleep deficit, which means recovery is low, which means stem cell production is low, which means human growth hormone is low. All these, cascade of factors. Stress is higher, cortisol is higher, recovery is lower because of that as well. And so the recovery is down as a whole. And then maybe they haven't been moving as much because of that. So now they're more stiff. Okay. Now at the end of the week, maybe they're like, I just got to go to the gym and crush a workout to release some stress. And now they do a movement that their body's not prepared for because of those factors. And that is what is the straw on the camel's back, so to speak, and triggers the pain episode, which puts them into this position. In which case their explanation should be, hey, look at your sleep, look at your work, understand that hurt doesn't equal harm. Just because you feel pain doesn't mean you have drastic tissue damage. Your spine's going to recover. You're good. Next week, get more sleep. Don't stress about work as much. Let's eat an anti-inflammatory diet and keep active, keep moving. And there's like a 99% chance you're going to be just fine.
Got it. Okay. Stu McGill, who wrote Back Mechanic. I'm not going to get this word for word, but I'm just saying that one of the ideas that he writes about in his book, Back Mechanic, is you want to go through your kind of day to day and be taking notes essentially of like, what is making your back pain feel worse and what makes your back pain feel better. And his idea is to stop doing all the things that make your back pain worse and start doing all the things that make your back pain better. And I'll give you an example. Like my dad has had terrible back pain. And it seems to be anytime he's like rounding forward. So for example, he loves to golf. When he goes down to tee up his ball or to grab the ball out of the cup, he would injure his back and have a really tough time with that. And so we worked for a really long time. I'm like, well, you still we want you to golf, but pick up the ball differently, tee up the ball differently, try to have your spine a little bit more upright so that you're not rounding so much. Things like mowing the lawn, grocery shopping, pushing a cart would make it worse. Do you agree or disagree with that?
Oh, I could talk about that one question for, I'm not even joking, 2 hours. So
Great.
there is so much context that is involved in that. And I'll try to focus on the most important ones. Um, if you're asking me, do I agree or not? I can't say I agree because there's too many variables that need to be included. One, we don't want to train people that movements that create pain are bad and should be avoided forever. There shouldn't be a period out of that statement. Avoid what hurts, period. No, no, that is not helpful because what that develops is fear avoidance behaviors. Your nervous system learns and your brain rewires. So if every time I bend forward, I feel pain, which is the most common type, by the way, that's flexion intolerant lower back pain. It's extremely common. We fix it every day. If I, if my message to my brain is don't bend forward because I experience pain, and let's pretend that I can get away with that. So I can go through my life normally and I can experience no pain if I avoid flexion. My brain will memorize that anytime I bend forward, a pain response should be elicited to protect me from what I've trained my brain to know. So fear avoidance behaviors are very dangerous. That's what creates chronic pain. If the answer was, hey, right now in this moment for the next 1 to 2 weeks, do less of what hurts and more of what feels better, that would be a better response. The sad part is that a lot of, I'm trying to have an appropriate answer here. A lot of the training sometimes in that camp is not adding that nuance. It is telling people, hey, every time you bend your spine, you're providing micro damage, and that micro damage will build over time, and then eventually you're going to need a procedure. So you want to keep your spine neutral in all aspects of life all the time, and that is absolutely not true. It is not supported by the evidence. These studies were performed on dead pig spines, which obviously are not alive and therefore cannot show adaptive changes. It doesn't exist. It's under the notion that discs can't adapt, that discs can't heal. That's absolutely not true. The current evidence very clearly shows us otherwise. So there is some outdated evidence that is included in those notions. So if this is temporary advice, okay, but they need to be told it's temporary. So I would tell that person, hey, these movements hurt you. Okay, for right now, we're going to avoid those, but we're not avoiding these forever. We will get back to those. You will be doing those 100%, and you will be doing those with load. So they need to understand that message. It completes the circuit in their brain, so to speak, is this isn't dangerous. This is something I will be doing in the future with load. I'm just avoiding it for this time to reduce my flare ups so we can accelerate the initial rehab process. That's the
Got it.
message.
That's a really good answer. And I'm just kind of thinking to myself and taking notes, like how would somebody know what movements would be appropriate? Like you're talking about, how important it is to keep moving. You talk about load quite a bit as well, like why body weight isn't enough. I know I'm throwing a lot at you here, but how does somebody know which movements they should be bringing in? Is it just as simple as like this doesn't hurt kind of a thing when they're deciding what to try?
Yeah, I'll give you a couple specifics, but like one, simply put, you could say that. Like if you said, and here's why I'm really gonna get into the weeds and I'm gonna back out. Okay, is you said earlier, hey, like do more of what feels good, do less of what doesn't, and I kind of answered the do less of what doesn't scenario. But the do more of what feels good, there's two reasons why that can be very impactful. One is an actual mechanical component, meaning movement, but the other is a psychosocial mental component. So if I've been in chronic pain for a while, and these are real scenarios, by the way, like this type of stuff happens all the time. Let's say I'm someone who's had chronic back pain. And yeah, every time I bend forward, I feel pain and I can't I can't work out in the gym, whatever. But let's just say every time I do pottery, I have no pain. Let's just pretend in that scenario. Every time I'm building these things and doing pottery, I'm just in my happy place. And I feel no pain, even if I'm in a slouched position, even if my posture is bad, where if I'm in a slouched position working, my back hurts. But if I'm in a slouched position doing pottery, my back doesn't. That's very mindset driven. So I would want to do more pottery. Simply put, I would want to do that activity more because I have a mindset component, a mental component that needs to be included in my process. So I'm like tiptoeing into those weeds, and there's so much more behind that curtain, but I got to back out because it'd be there forever. The movement component now is there's a mechanical process. If your joints, your muscles, your discs are not getting enough of a certain motion, it's going to crave that. And if you give it more of that, it accelerates the recovery process. So if you find movements that don't hurt, then you for sure want to do that because your joints, your muscles, and your discs and your nerves are telling you, we like that. Give us more of it. So here's the most common example that almost everybody listening can apply. You mentioned your father feels pain bending forward. Flexion intolerant pain is the most common back pain, meaning the longer you sit, the more you feel it. Bending over to touch your toes is tight and limited. Maybe trying to bend forward, you notice you feel some extra radiation down the back of your leg. That sciatic nerve is being pulled. And maybe when you've been sitting for long periods, you go to stand up and it's really tight to stand up straight. You feel 80 years old standing up. What our body's telling us is we're getting too much flexion forces, too much bending forward. What is it telling us we're not getting enough of? We're not getting enough of the opposite. So we're getting too much this way, not enough this way to balance it out. Here's a helpful analogy. If I kept my bicep flexed, if I kept my elbow flexed for 8 hours a day, do you think it would hurt, Casey?
It wouldn't feel great.
Yeah. If I kept it straight for 8 hours, how would it feel?
Also, probably would not feel great.
Correct. But if I move it throughout the day and I get in different positions, I'm going to feel pretty good, right? Okay. Now, if I sit and I slouch like this is commonly deemed across the internet as bad posture, right?
Right, of course.
Okay. So if I sat in this position for 8 hours, how do you think my back would feel?
Well, probably not great.
Probably not great. Okay. Now here's the light bulb. What would the internet describe as this posture?
They would say it's perfect posture. Your shoulders are in alignment. Your hands should hang in an exact certain way to your side. The alignment of your spine that everybody talks about. Yeah, they'd say it's perfect.
Perfect. What if I sat like this for 8 hours?
Probably wouldn't feel great.
Exactly right. So there's no perfect posture. You want to be in as many different postures as possible because that's what equalizes the forces throughout the body. So the perfect posture for you is the one you're in for the next 5 minutes. Okay, that's our posture myth checked off the box. So how does this relate to the scenario I was drawing? If I have all these forward forces, it means I'm not equalizing the stress on my body. So if I'm getting 8 hours of forward-based positioning, I need to do more of the opposite to balance it. I need to get into extension. I need to lean backwards. I need to get my hips into extension, my low back into extension, my thoracic spine into extension. I need the opposite range of motion of the one that's triggering my symptoms. That's the most common result for flexion tolerant low back pain. And this applies to other regions of the body too. Maybe you do a lot of stuff with your shoulders and you're always reaching forward and you have shoulder pain. When was the last time you brought your shoulder backwards? Probably not often. Take your shoulder backwards multiple times. There's a high chance your pain will reduce. And the same thing applies to your lower back because it shifts the stresses in the disc the wrong direction over time. So when you start to give it more of the opposite, it starts to shift it back. It starts to move things back to where we want it to be. And it starts to equalize that pressure. And then that flexion tolerant low back pain that's been there longer than you want, we're starting to see that disappear.
Got it. Okay. And my personal trainer brain for almost 2 decades, the way you've explained this is another thing I'm thinking like, oh my gosh, have I gotten this incorrect the whole time? When I see that slouch, so if you're listening and not watching, what Grant just demonstrated is very common where the shoulders are kind of falling forward. I would commonly say like everything you do is in front of you. You're on screens, you're on the computer, whatever. It's your body adapting. So I want you to go to a gym and do rows. To strengthen that area, because once we can get the muscle stronger, then it gets tighter and gets shorter and can help pull your spine into better alignment. And from what I've heard you talk about, that's not true. I have that wrong.
It's not wrong. You are taking them a step in the right direction, but that's focused more on like a mechanistic 1 + 1 = 2 scenario. So like tight muscles don't like automatically pull. Like that's also another myth. Like a lot of people think, why would I strengthen my hip flexors? That's going to make my hips tighter. No, that's not true at all. So You are correct in the force production standpoint, though. If I'm dominating my body with forward based movements, it doesn't matter if I'm training chest or shoulders or whatever. If you're telling me to train back, you're still accomplishing the goal of getting me to load my body in the opposite direction. So you're still promoting that. You're promoting my spine moving the opposite direction. You're promoting my shoulders moving in the opposite direction. So it's still promoting that. But the explanation of, hey, we're reinforcing muscles and the muscles are going to reverse, sorry, talking really fast and slurring here. The muscles are going to reverse all the stress. That notion is not true. So, like, yeah, if I'm not training these particular muscle groups, like, duh, let's fill those gaps. Let's train what we're missing. Absolutely. But in addition to that, I should have shoulder and spine specific movements that can take the joints the rest of the way that the muscular movement cannot.
Got it. Okay, so maybe I accidentally got it partially right, but only
For
on
sure.
accident. That's a good explanation. I really like that. I kind of tried to ask this earlier, but I threw like 17 questions at you at once. Tell us why the load component is so important, and why a lot of this stuff cannot be accomplished by just doing body weight stuff.
Yeah, because load ultimately is what creates long-term adaptive changes. Like, think of it just progressive overload. Hey, I want to bench 225, so I'm just going to bench the bar for the next 3 years. All right, like you're not going to get there, you know? So the adaptability of your tissue and spine and everything else, it operates the exact same way. So if you want a strong, resilient spine or a strong, resilient core, hips, neck, whatever, in order to progress that, we need progressive overload, which is adding load to the area, which makes those results last. So, like some really good take home examples is, let's say I do the necessary movements of my spine. Okay, I'm flexion intolerant. Okay. I start doing cobras more because that's extension. Awesome. You're going to feel way better. Do this repetitively. Don't hold them, do them throughout the day. Great. That's an intro point. My mobility returns, my pain goes away, but I'm not done. I need to now load that tissue, load myself into extension to make those results last. So now I should be doing deadlifts. I should be doing squats. I should be doing weighted extensions to load that range of motion that I now acquired and to load the tissue that's now recovered for long term adaptive changes. Let's take hip flexors, for example. My hips are so tight. My hip flexors are so tight. Oh my gosh, I just need to stretch them. I haven't met anybody that got long-term results from just stretching their hip flexors. So it's okay. Sure, if you want to stretch them because it feels good, great, do it. But then after, if you've improved your range of motion by, let's say, 15 degrees, 20 degrees of hip extension, let's say, which is like massive. Okay, you want to keep that range of motion? Go load the hip flexor. Like, imagine I'm in a typical hip flexor lunge, let's say, just for the sake of everyone imagining this. I'm sitting there in a passive stretch. I get better mobility. Awesome. But now let me tie a band around my foot. So now there's something pulling my leg back and I'm going to resist it. And I'm going to start doing knee raises and driving my knee forward, resisting that band. And I'm going to perform that over and over and over. So I'm loading my tissue in the new range that I just acquired. So my body can control that range and now truly adapt to that range. So my hip flexors don't just immediately get tight again. Super applicable stuff right there.
Yeah, no, that's perfect. Very well explained. I love that. I assume you are a fan of training the spine in all ranges of motion, all planes of motion, excuse me, rotations, working laterally, all that stuff.
100%. The more ranges of motion, the better, assuming the person is of a capable state to do so. I wouldn't take someone with a disc herniation that occurred 3 weeks ago and say, all right, we're into Jefferson curls. No way. That is stupid. That's not good for patient outcomes. But if someone is healthy, the more variability of exposure, the better.
Got it. What about loading the spine? I've always been taught that like a back squat would be inferior to something like a front squat because you're loading pressure through the back and through the spine. I think you're going to have something to say about that as well.
Yeah. Inferior in what context? What's the goal?
I mean, lower body strength, right? But you can accomplish that by doing lots of different things.
For sure. So, like, here's what I would say. If someone said, Grant, I heard front squats are better than back squats, there's a series of questions I would ask. I would say, one, do you have a low back injury? Let's say they say yes. Okay, what kind of low back injury? How long has it been going on? Do you have a rehab protocol? Okay, let's say we go through all of this and I go, yeah, well, don't blame your squat. Let's fix your back and then you can squat however you want. Okay. Now let's use the context of, let's say someone just joined our program. Let's say someone joined my online low back program and they're saying, I'm a gym nut, as am I, and I got to stay in the gym. I want to squat. What can I do? I'd say, all right, you're flexion intolerant. Loading up a back squat isn't a good idea in this moment. Let's load you up with some goblet squats or front squats. That's good enough for this time. That is superior in this moment with this context. Okay, now we get them better. All right, what's your goal? I want to build the strongest legs that I can. Okay, what can we load more? Front squat or back squat? Back squat. Can your back handle back squats now? Yes. Do back squats. If the goal is what's for long-term back health, both. Movement variety. Do both. It doesn't matter. There's one or the other is not going to be better or worse for long-term spine health because your spine can adapt. That's not a concern. So there is no inherent exercise that's good or bad or worse or better. It doesn't exist. It's just the movement you're not adapted to.
Got it. No, I love that. When you talk about an anti-inflammatory diet, you're talking to a large contingent of people that are interested in metabolic health, they're interested in diet. What would an anti-inflammatory diet look like to you?
Yeah, so I'm going to stay within my lane for sure on this one because I'm not the nutrition guru, but I know enough to get people better and I know enough to talk about it a little bit. So I'm going to keep things super, 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 super basic. So first off, the best anti-inflammatory diet someone can have is not being overweight. It's not the diet. Okay. Being overweight is going to produce more inflammation throughout the body than any diet could produce. So my example here is a much better scenario is someone who is a proper body weight who might be consuming, let's just say for the sake of the example, Doritos and fast food burgers and sugar all day, but they're not over consuming it and they're at an appropriate body weight. Inflammation in that person is not going to be a primary concern. If there's someone who is over consuming food massively, and on paper, the food they're consuming is cleaner than the leaner individual, that person is going to have more inflammation in their body. So I want to say that first. Okay. I'm not like, if you eat a Dorito, oh my gosh, you're inflamed. No. Appropriate body weight trumps everything. Caloric balance trumps everything. So now let's standardize the equation. We're talking about one type of person in every scenario. Okay. Now we're standardizing the control. Typical recommendations for our clients is going to be a reduction of gluten, a reduction of dairy, and a reduction of grains, sugars, flours, things of that nature. I'm not demonizing any one of these things. I want to be super clear. I am not demonizing any one of these things. I'm mentioning these things because these are the primary things that can create an inflammatory reaction that can perpetuate a low back pain incident. If you don't have an intolerance to dairy, then that is not something you would need to remove. If you don't have an intolerance to gluten, then it is not something you need to remove. I'm giving a catch-all response. So generally speaking, if you're like, I don't know, but I just want to cover all bases. All right, for the most part, if you reduce flour, grain, sugar, gluten, dairy, you're going to be covering most of your bases. Your, chances of being inflamed are going to be really, really low.
Well said. I love that. I think anybody could get on board with that. If somebody wants to just cut to the chase and get all that stuff out, probably beneficial, but not what everybody has to do. So really, really appreciate that answer for sure. Tell us a little bit about how you developed your program to be able to work with people all over the world without having to see them in person.
Yeah, because it's an evidence-based, movement-based approach, man. So like my number one mission going to school was to be literally the best. Like I invested heavily into my education. School alone cost 250,000, but within my first trimester, I spent like an extra $3,000 on seminars out of my own pocket, not loans. And my classmates thought that I was crazy. They're like, you're just starting school. Why are you spending so much on seminars? I was like, because I'm going to be better than you. So I heavily invested into being the best. And what you learn throughout that is you find the right movements, the right positions, the right tricks, and you can get the vast majority of people better without having to touch them. You can coach someone through testing. You can coach someone through orthopedic testing. You can coach someone through the right movements to do for that particular condition. And if you become truly a rehab clinical master, you realize Yeah, I can really coach you through the whole process. So I had built such a large social media following that I was getting messages from people all over the world, and I was becoming a referral machine, like sending people everywhere. And then I realized maybe I should try to help these people. So I started, the way this started, man, no joke. I was texting people exact step by step things to do to test their condition and then how to test the movements they should do. So I was texting people orthopedic evaluations and ranges of motion and diagnosing them through text and treating them through text. And then I was like, okay, this might be easier if I got on a phone call. So I got on a phone call, got people pain free over the phone. Try this test, try this test. Okay, now try this exercise. Lay on the ground, put your hands here, push up. When does it hurt? Okay, just go to that point, do it repetitively. Okay, now let's do this. Okay, got people pain free over the phone. Then I was like, okay, Zoom would probably be easier. So then I started getting on Zoom, doing initial consultations, getting people pain free all over the world, Germany, Saudi Arabia, New Zealand. And then I was like, okay, I need to build a plan for this because I'm seeing all these people with similar cases with low back pain, disc herniation, sciatica, who are being told all this nonsense. I need to build a plan. So then I built a plan, I built a program, figured out how to advertise for it, figured out how to grow my social media even more, built an evaluation process for it. So there isn't a single person that comes into our program that hasn't had a 1 hour evaluation with us where we actually go through a diagnostic process. We take them through exercises, we take them through rehab on the call. Our average client gets around 37% reduction in their pain in their first call with us before they go into our program because we use that call to customize it. We use that evaluation to understand the specifics of their condition and then shape the program to that. So we deliver results first. Everything's customized. You get one on one communication with a physician that's at your fingertips the entire time. You have daily communication. It's very high level to deliver a premium result, of course. And yeah, we're canceling surgeries every single day. And people are coming to us when they've tried all the in person chiros, they tried all the in person PTs, they tried the injections, they have the surgical consult. And then the online program is the thing that gets them pain free.
It's amazing, man. It's just such great job satisfaction when you're actually able to help so many people out there. I really love that. Are there any plans to expand in the future? Or are you quite content with how things are going so far?
I have people in Saudi Arabia wanting me to plant brick and mortars there right now, actually. Right now, the biggest push is just building my content management team because we're posting 3 times a day now. And it's difficult to get my brain into other sectors of the business and of the media. I'm gaining 1,000 subscribers every day. I'm getting 2,000 followers every day. So just building the online audience, building the team to support it, and then building the regions of the world that we can reach. That's the number one focus.
Amazing. Well, dude, you're doing great work. I absolutely love that. I've really appreciated your content and coming on today to answer some questions and dispel some myths. Obviously, as we alluded to, this is a problem that really needs to be addressed, that a lot of people are dealing with out there. And I love your work and I love your content and everything that you're doing. So for now, Grant, where can people go to find you and connect with you and your work?
We're on all social media platforms. Instagram is our number one hub. And if you're on Instagram, I have a gift for your audience, Casey. If you guys are listening, you're going to get something that I have not posted anywhere. It is not anywhere on our social media, it's not anywhere on our website. It's a secret for you. And if you message us the word podcast on Instagram, just the word podcast, nothing else, I will send you a link to a training. And this is an in depth training that will actually take you through a self guided evaluation where I will walk you through different tests to do for your lower back. And I will explain to you if one hurts, what that means. If another one hurts, what that means. And based on what hurts and what doesn't, I will give you live recommendations based on that self diagnostic test to what to do, what to perform, what you should feel during it. And then I'll coach you through retesting it and then interpreting those results so that through this training, I will walk you through what's causing your pain, the direction you need to go to fix it. And then, of course, you'll have the opportunity for more coaching and guidance if you choose to do so.
Well, that's amazing. Well, thank you very much for the kind gift. We'll be sure to put that in the show notes. And yeah, for now, Grant, I found this conversation very enjoyable. So thank you so much for everything you do. And thank you for taking time to be on our show today. We really appreciate you.
Pleasure being here, and thank you for having me.
Absolutely. It was an honor. And this has been another episode of Boundless Body Radio.